I'm 68 years old, and I live in Bristol, Oklahoma. Ralph and I have been married since 1956 for 51 years. We had a son and a daughter. I have 2 granddaughters and 1 great-granddaughter. Well, I worked for doctors for several years, some surgeons, and I assisted them with the patients and did the insurance and the billing. And my husband retired in 1989, so I quit my job and moved up here and just been living out in the country ever since. Well, I was at McDonald's and I bent over to wipe a table, and when I did, my heart just started racing, and that was the beginning of it. And for years, that's what it was. So Ralph took me to the hospital and they diagnosed me with tachycardia. On Thanksgiving evening, my heart started racing. That was when I was diagnosed with atrial fibrillation with a rapid ventricular response. And that's when they started giving me medications, and I've just been one medication to another, and it seemed like they would help, but nothing ever stopped it. And as it went on, it just got worse and worse and worse.
So she remained on Tikecin or dofetilide for many years for her atrial fibrillation, and again was having weekly to bi-weekly symptoms, was extremely unhappy. I met her approximately a year and a half ago, at which point we recommended atrial fibrillation ablation.
Well, we chose the ablation because it was the lesser of the 2 surgeries, or I felt like less invasive. I felt better almost immediately, especially after I got out of the hospital. And before I had the surgery, I had to stay in my recliner just about all the time. But anytime I put any stress on my body, my heart would start racing. A lot of times when we went to town, I would get one of those motorized carts and ride those because I just could not walk over those big stores. Now I just get a buggy and just go and buy groceries or whatever, no problem.
Atrial fibrillation can be highly symptomatic in both men and women. I think that people need to not underestimate the importance of diagnosing arrhythmias in women and treating them the same as you would if they were a man. When we look at numerous databases, we find that men are overwhelmingly treated more aggressively for atrial fibrillation. I think she should do wonderful. Again, she had normal heart function, her valves were normal, she does not have out-of-control hypertension or sleep apnea, some of the things that can really be the markers of a poor prognosis for their atrial fibrillation. I think she's going to do wonderful.
Anything I want to do at this point, I think I can do it. And that's just about the difference, like, you know, night and day from the way I was to the way I am now.